Heart disease in young people may be linked to the diabetes exposure in the mother's womb, according to a new study that has just been published in the Canadian Medical Association journal. Uh, and it has been shown that in this cohort studies, where the researchers were following babies born between 1979 to 2005 in Manitoba, Canada, they were tracking almost 300,000 children until March 2015. The mean follow-up was more than 20 years, up to age 35. And the researchers were looking at the effect of gestational or type 2 diabetes in mothers, and the risk of developing cardiovascular disease, heart disease, in their children at this young age, and also cardiovascular risk factors. Over the course of a few decades, 2.8% of children were exposed to gestational diabetes, and 1.1% were exposed to type 2 diabetes in their mother's womb. And the most frequent diagnoses in offspring exposed to diabetes were high blood pressure, type 2 diabetes, and ischemic heart disease. When the researchers looked at the age of the offspring on the x-axis and the incidence of cardiovascular disease, the cardiovascular disease events on the axis y, we can see that no diabetes in the mother was protective against getting heart disease compared with having gestational diabetes or type 2 diabetes. The same or similar trends were observed for cardiovascular disease risk factors such as high blood pressure or diabetes. Again, no diabetes in mother was protected compared with gestational diabetes or type 2 diabetes in the mother. And this is just another plot showing that the offsprings had about 30 to 80% increased incidence of heart disease if their mother had diabetes during pregnancy, and their risk of developing cardiovascular risk factors such as high blood pressure or diabetes was 2 to 3.4 times higher. So to summarize the results, children born to mothers with diabetes in pregnancy had a 30 to 80% more, were 30 to 80% more likely to develop heart disease, and were also 2 to 3.4 times more likely to develop cardiovascular risk factors such as high blood pressure, diabetes, and so on. So now the good question is, how can we prevent diabetes when it has such far-reaching consequences during pregnancy? How can young women protect themselves against getting diabetes in pregnancy? First of all, eating a plant-based diet can protect against getting diabetes. It can cut your risk of getting diabetes by 50%. Another protective factor is eating when time is right, having a big breakfast, and eating only light dinners with no snacks in between, and lunch being on the second biggest meal of the day. Regular physical activity and getting enough sleep. These are the most important factors how we can protect ourselves against getting diabetes. And this is especially important because the health of our children is in our hands, almost literally. So thank you so much for your attention, and I'd like to hear from you. What have you found useful to protect yourself against diabetes, and what have you done for your children to protect their heart health? You can post on the comments below. Thank you.